Thank you so much for your time. Please take it away.
Thank you so much. And thank you, Khan, for inviting me to do this wonderful health hour. Happy New Year to you all. We can say that up until the end of January, which is fast approaching, but happy 2026. And here is to a happy, joyful, healthy year ahead for all of us. Wonderful to be back again. And today, the topic is vaccinations. What to really bring out some of those elephants in the room in terms of some of the myths. We know there's plenty out there, give a little bit of a timeline of what public health is really about, and talk about the diseases and what we're trying to achieve, because no one wants to do harm. We're not in this medical profession to do harm. We want to prevent illness, ideally. I'm a GP. I'm in the business of prevention. My dear mother will always say prevention is better than cure. And vaccinations are one of the really powerful tools in our toolkit of medical strategies that can prevent serious illness from several diseases. And I want to list those diseases because I think we get complacent about the fact that, oh, those things aren't an issue anymore. Let's remember them and remember why we want to vaccinate. So let me share my slides. Let me know if you can see it okay. And we can have I always love the discussions here. Can you see that on full screen? Yeah.
Yes, we can see.
Yeah, wonderful. So let's dispel some of the myths. Let's talk about some of the facts and let's have a conversation and bring out some of those elephants in the room we know that's there about this topic. So, yes, as I said, I'm a GP partner and trainer. I've been a GP now for today. This year will make it 2012. That's 14 years I've been a GP for, and a doctor for 20 years this year, which I'm quite proud of. But I can't quite believe I'm this age because I still feel like a baby girl. But I was introduced as a young lady, so I'll take that. So, a little bit about how vaccines work. Vaccines are, or immunization, so it needs your own immune system to work. They contain either a weakened or dead version of the virus or bacteria we're trying to protect against. And it shouldn't cause the actual illness. That's not the aim. The aim is to introduce the body to a part of it so we form antibodies with our immune system. So we receive the vaccine, our immune system is stimulated to produce antibodies that are similar or better than if we were infected by the actual virus or bacteria, so that then our immune system have these memory cells that stay like in the background. So if in the future we're exposed to that virus or bacteria, our bodies can really quickly produce the antibodies and fight off the disease before we even become ill. Or even if we do become ill with the condition, it's a much milder version that doesn't need us to become really unwell, get complications from the illness, and hopefully not get into hospital as well. What is in a vaccine? So the main active component, actually most of it is water, the main ingredient, but there's the active component, which is that antigen, which is that either deadened or smaller tiny amount of the virus or bacteria we're trying to protect against. There's ingredients called adjuvants, which are substances like aluminum salts, which are added to enhance our immune response to the antigen, because we want to make all those great antibodies that protect us. There's stabilizers to keep the vaccine effective, preservatives to prevent contamination, and there are no harmful levels of toxins. You'll hear about high metal levels and high pollutants. It isn't true, because ultimately we are in a era where we go to the supermarket, we collect food. Do you know how many preservatives to keep a shelf life? Similar type of concept in making sure the vaccines are safe. They can be distributed safely to your GP practice or to your hospital. And by the time they come into your arm, they're safe and able to do the job we want them to do. So some of the common myths. The big one are vaccines cause autism. Autism, this condition, we're seeing more children and adults actually diagnosed with this. We don't have a full understanding of the cause. We think there's some genetic component. Is there an environmental component? But there's been study after study after study done that says vaccines do not cause autism. There is no direct link. So we need to keep thinking, what are the reasons? We need to keep making sure there's support for families affected, but vaccines do not cause autism. The other myth, natural immunity is better than vaccines. Now, it's not one or the other. We need our immune system, as I just said, to get the vaccines to work. So ultimately, we natural immunity in terms of being exposed to the condition yourself is better than vaccines. It's not the case. Vaccinations will protect you, usually better than natural infection. And the danger of waiting for natural infection is that you put yourself at risk of serious illness and complications. Vaccines contain harmful toxins, already addressed that they do not cause or contain harmful levels of toxins. It's really closely monitored. We have the Medicine Health Regulatory Authority, the MHRA, that really tracks these things and really, really careful regulation of any ingredient that goes into vaccines, making sure the companies are meeting up to all the high standards needed. And the other myth is that these diseases aren't an issue, they're gone, so vaccines aren't needed, or the disease isn't a problem. Measles is only a mild illness. These diseases are not gone. So, polio, we don't see polio in the UK anymore, but polio is available in parts of the world and can cause serious disease and infirmity. Some of you may know the basketball player. He's British, but of Nigerian origin, Ade Adepitan. He played wheelchair basketball and he's a presenter on many shows on TV. He had polio as a young child and was wheelchair bound because of it. So these diseases aren't gone. We just, because we vaccinate large numbers of people, we don't see them as often. So I'm keen to name some of these diseases and infections because I think there's a complacency say, oh, we don't see them anymore. As a GP, I've never seen diphtheria, but I never want to. And it's because we vaccinate. So some of the viral infections that vaccine protect against are your measles, your mumps, your rubella. We give it in a combination vaccine called MMR. And from January this year, we've started giving it to our toddlers in a combination with chickenpox, varicella, so MMRV. There's polio viral infection, as I've already mentioned, can cause debilitating disability. People can be wheelchair bound or have problems with mobility that's lifelong and is completely preventable with vaccination. Influenza or the common flu, we've all been getting our flu jabs, I hope, this winter season. COVID 19, you can still get your COVID 19 if you're eligible. So that's the over 75. And if you're very immunosuppressed or live in a care home up until the end of January. So it's only another week it'll be available for this winter season in the UK. We can vaccinate against hepatitis A and hepatitis B. There's not a vaccine for hepatitis C as yet. HPV, now this is a big one I'm going to talk about in a bit more detail in a minute. So the human papillovirus, HPV, causes cervical cancer, penile cancer, anal cancer, and also some of the cold sores. There are lots of different types, but the most common types that cause some of the cancers, we can vaccinate against it. And really, really excitedly, we want to eliminate cervical cancer in the next decade, hopefully. I mean, that's massively exciting. A vaccine can potentially prevent cancer. Rotavirus is a respiratory illness, and no, rotavirus, sorry, causes a gastrointestinal illness, so vomiting, diarrhea. We give babies that. Chickenpox, I've already mentioned. Shingles vaccine, but then we're talking about the infection we're trying to protect against. But these are some of the vaccines we have available. Rabies, we don't see rabies in the UK, but if you were to go abroad, you may want to consider getting this vaccination. Yellow fever is an infection, again, we see abroad. Travel, if you're traveling, and there's some areas, especially traveling within Africa, you have to have your yellow fever certificate for them to let you in the country. Japanese encephalitis is an infection vaccines protect against. Another type of encephalitis is tick-borne. Dengue, Ebola is an infection, and there's a vaccine that they've developed to protect against that. We all know about the Ebola crisis that affected parts of Africa and is still in parts as well. Smallpox. Now, we don't see smallpox anymore. It is an old infection that we don't see, and we don't see it because of vaccination. RSV is a virus that causes respiratory illness. We've now started vaccinating pregnant women and over 75-year-olds with this, and it's available throughout the year. And mpox, there was an outbreak, so there's some eligible population that's eligible for that vaccination. Some of the bacterial infections that we can vaccinate against. TB, we all maybe remember getting our BCG as children vaccine. Diphtheria is a bacterial infection. Tetanus, I never want to see tetanus in my life. I hope I never see it, and we don't see it because we vaccinate. Pertussis or whooping cough. Now, we've started vaccinating pregnant women to protect the very young babies from this. Hib, Haemophilus influenza type B, pneumococcal disease, meningococcal disease, there's MemB, MemC, MemW, MemY, typhoid fever, cholera, and anthrax. So these are infections we're trying to protect against. So I couldn't let January pass. We are in January without stressing on this point. I mentioned HPV, human papillovirus, that we vaccinate against. And we think that eliminating cervical cancer is achievable by 2040 to 2050 through high uptake of the HPV vaccine. So we want to target over 90% coverage. And of course, keep going with robust screening. So this is a reminder, friendly reminder, to book that smear test in with your GP. And also talk to your teenagers about the HPV vaccine, which has been offered in year 8. I don't want to see a situation where our population, remember, this is us, for us, by us. We're here on this health hour, us Black clinicians talking to our Black community. I don't want to see a situation where in 10 years, 20 years down the line, we're seeing higher rates of cervical cancer in Black women because their parents didn't agree for them to be vaccinated when they were in school. Because we're seeing there's a real chance we can eliminate cervical cancer. Australia have announced they think they can do this by 2035. Denmark announced that they've almost eliminated the circulation of the common HPV viruses that cause cervical cancer just by vaccinating. So this is true. This is really powerful. Vaccination can prevent cancer. And I don't want to see a case where we haven't agreed for our children to be vaccinated in school and we're seeing higher rates of these cancers further down the line in our population. So, a little bit about what is public health, because people don't always realize there are the 3 P's of public health: promotion, prevention, and protection. So, health promotion, disease prevention, and health protection. And public health is the single most intervention that has saved countless lives over generations. Some of the ways in the past, I'll show a timeline that we've saved lives, are things like sanitation, the fact that we have flushing toilets, the fact that we know about washing hands, the fact we know about infection control, are public health measures. Some of the other things that we've done more recently in the UK. So there's PrEP, which is pre-exposure prophylaxis to reduce HIV risk. So that's disease prevention again. New vaccines, COVID-19. We all remember the pandemic 6 years ago now, but very much still in our awareness. And so the COVID-19 was a new vaccine. Lots of different people worked very hard to bring up a solution. And along with all the other strategies, we were able to stop the pandemic. There's health inequalities, looking into the reasons why there's age discrepancy in terms of how old you are when you die in different parts of the UK, different parts of the world. Also in the UK, there's all sorts of things lead to health inequalities: how you access health, your access to health, your awareness, how you receive information, all of this funding into various areas. Smoking regulations. Who remembers the smoking ban? We can now go out. We're not allowed to smoke cigarettes indoors. You have to be outside. This is all public health measures. Viral hepatitis prevention with awareness and vaccination. Healthier food consumption. I think the food industry has a lot to answer for and there's a lot more work to do, but the sugar tax was one way to trying to tackle some of the issues with the food we consume. Women's health strategies with things like making abortion more accessible and also making awareness of some conditions that there's not been as much research and awareness into: endometriosis, and in our group, fibroids as well. Lots of strategies to try to tackle this early and protect women from some of these conditions. And enhanced clean air policies as well. Just some of the areas public health has been working on in the UK in the last 5 years. But going back in time, This is courtesy of Walsall Council. Just some of the historic dates. The Clean Air Act was back in 1956 to control things like emission, smoke, grit, dust, fumes. But now with climate control, and I always say London, I'm based in London, we're all allergic to London air. And then measures like even the which we all hate, the congestion charge that stops drivers driving in central London at certain times. And then the Low Emission Act, we're all supposed to get better cars. All this is about trying to improve public health as well. What else out in here that I'm going to highlight? 2026 affecting the sale of tobacco products. So we can't smoke in enclosed public case areas. And the plan is to stop children being able to ever buy cigarettes at some point, you know? Childhood flu vaccine was introduced as well back in which year was this, 2013. So that's the school aged, we're offering the vaccine to school aged children. There's a traffic light labeling on packaged food, but like I said, we need a lot. The food industry still has a long way to go. The sugar tax I've mentioned, the soft drinks industry levy, and then the smoke-free targets. The government wants that us to be smoke-free by 2030. That's the idea. So just some of the historic dates. The back in the 1848 was the Public Health Act, the Sanitation Act of 1866, the Maternity and Child Welfare Act of 1918, as well as the discovery of penicillin and our NHS being established in 1948. This has saved countless lives. It is not an accident that health expectancy is higher in the UK. There's certain strategies that's really important that we need to think about and think about how we continue to build on successes of the past. Just another timeline of all the different things that public health has done. We forget in 1918, the Spanish flu pandemic, we think infected an estimated 500 million people and killed millions. So we forget that these pandemics can be really deathly. And we're now very complacent about flu, but there's a reason we still need to vaccinate and protect against it each year. It can be a very dangerous illness. So some of the benefits of vaccination, we know one of the myths is that these diseases have gone away. They've not gone away. They're vaccine preventable. We don't see diphtheria or tetanus because we vaccinate against them. Vaccines will help to keep you healthy. Of course, it's not just vaccination. That's one powerful toolkit. But we all need to move more. We are all in January doing our dry January, and I'm on my no caffeine, no alcohol, no sugar plan at the moment, just trying to start the year right. So we want to do all the other right things, but let's do it all. We want to reduce risk as much as possible. We know vaccines are as important to our overall health as that diet and exercise. It can mean the difference between life and death. Vaccination is safe. They're rigorously tested. Vaccines cannot cause the disease they're designed to prevent. They get your immune system to work. So you may feel a bit run down after having a vaccine, but it definitely shouldn't be as severe as if you get the illness itself. Remember, young and healthy people can get very sick too. So vaccines prevent illness in the young and healthy, as well as the old and vulnerable. Vaccine preventable diseases are indeed preventable. And when you get sick, remember, we're not just silos by ourselves, we're part of communities. So we have a responsibility to our children, grandchildren, parents, all those we look after around us. So if we get sick, we may be putting them at risk too. So our family, friends, and neighbors and community need us to get informed and then make certain decisions about our health that will benefit all of us. Just a reminder about some of the vaccines currently available this winter period, because we are still in the winter. You can get RSV if you're over 75 and if you're pregnant. The flu vaccine is actually still available if you have a long-term condition, if you're a healthcare worker, if you look after someone that's vulnerable, if you're over 65, and all the school-aged children are offered it, and that's available up until March. Shingles vaccine, 2 doses now, available if you have immunocompromise and if you're over 65. And COVID-19 is available just for another week to the end of January. And it's a much smaller group we're offering it because COVID is not the problem it was 6 years ago. We're actually offering flu to many more people than COVID-19. But there is a small group of people we're offering COVID-19 to. If you're over 75 years old, if you have a severely weakened immune system, and if you live in an older age care home. So COVID-19 is available just for another week or so till the end of January. Then we start again for a spring campaign and then go again in autumn. But we wait to be advised by the Joint Committee for Vaccination or Immunization, which looks at the data, tracks it, and tells us which groups to vaccinate. On balance of risk and benefits, we always have to weigh these things up. Vaccines are safe. They've been tested thoroughly, they're constantly monitored, and we know the benefits far outweigh any risk. It is completely understandable to have questions or concerns about whether it's right for you as an individual, whether it's right for your family to receive vaccines. So that's why we're here to have a conversation about it. But just know there is a lot of misinformation out there. This phone, social media, it is powerful, but it can spread fear and misinformation and disinformation. So I always say if you have questions or concerns, I encourage you get to know your trusted healthcare professional. If you're under care at the hospital, talk to them. There's your GP. Our practice nurses in our GP practices are excellent and have so much information about vaccination. Your community pharmacist on the high street is very knowledgeable. Health visitor or consult, all of them can provide these evidence based information and signpost you to sites, websites, information where you can then continue to do research. People say they do their own research, but remember our social media algorithm, once you click on something, it will show you the same thing over and over. So it's really important to look at the balanced view and look at that evidence base, check the resource. Check the source of that information. Check the agenda. Are they trying to sell something? Are they trying to spread fear? Ultimately, we are in the job of prevention is better than cure. We're in the job of wanting our population to be as healthy as possible. So let's have a conversation. Thank you so much for listening. Let me get the slides down. And yeah, happy to have a conversation about it because I know it's a topic that people feel very strongly against or worried about. So that's what we're here for this morning. Thanks for listening.
Wonderful. Thank you again, Dr. Oge. Thank you for again. It's always informative. It's always educational. Every time you come on the Can Health Hour, it's useful for us to hear it from somebody who knows what they're talking about, but somebody who has an understanding of the issues that we might have in the community. So again, thank you so much for your time. I'm going to take 2 seconds to explain the immune system in the way that I explain it to people at work. So, the immune system, think of it like your body's immigration police. So, it's going around your body saying, are you foreign? And finding things that aren't you and highlighting it and saying, this thing is not me.
Yeah.
And then the immune system comes and attacks it with the cells. But the concept of it is really good because then it also helps me explain autoimmune. But yeah,
Yeah.
that's the issue for the immune system. The immune system is looking around your body to say, is this me? Is this me? Is this me? Or is it foreign?
Yeah.
And the purpose of vaccine is to let the immune system recognize, oh, this isn't me, so that when they actually meet the vaccine or the bacteria, they can have a proper response so it doesn't affect your body in the same way. So that's how I explain it when I'm on the ward.
I like
So
it. You got to
thank you again.
bring
Now,
ice and all of them into it, huh?
yeah, but
Yeah.
it's in the zeitgeist of community. So again, it helps people understand what I'm talking about. And to your point, I wanted to say specifically RSV in the
Yeah.
hospital. We're seeing a lot of
Yeah.
RSV, a lot, and people are getting really sick.
Really ill.
Having to go to intensive care, having to need oxygen, and it's a even for me, it's a bit of a change in what I expect to see younger people, old people on oxygen, but it's not a severe pneumonia.
Yeah. It's
It's
a
a
viral
yeah, exactly.
infection.
It's a viral illness. So I think we need to make sure we're taking this very, very seriously. So we have some questions. Um, let's have a look. Where are the questions? So, what are the top four vaccines we should take, and which one should I ensure my children should have received by age 6?
Wow, that's a big, it's not just four, it's many more than that.
Yeah.
So there's a whole schedule for children. And it's in the Red Book in terms of we start vaccinating our babies from 2 months of age. It can be earlier than that, actually, if eligible, if you're in a population, and most of us in the African population are in that population, where you're from countries where TB is high prevalence, then you may be offered the BCG within the first few weeks of life. So there's the BCG vaccine, then from 2 months, and then 3 months and 4 months, then again at 1 year, 13 months, and then again preschool at 3.5. We've now brought forward that some will be offered the MMRV, which is the new schedule at 18 months. So you're testing me now. Our nurses are even, it's a whole transition at the moment of getting used to the new schedule. But there are many, like the diphtheria, tetanus, polio, it's one combination vaccine. Your MMRV is one combination vaccine. So that's 3 plus 4 diseases we're protecting against with 2 vaccines. So that's the point of it. And people say, oh, isn't it too many vaccines? Our immune systems can't handle that many. Do you know how many bugs and bacteria and pathogens our bodies and our immune systems are exposed to on a
Every
day
day.
by day, second by
Yeah.
second? Literally thousands, millions upon we carry bacteria on our skin, so it isn't about our immune systems can handle it, our babies immune systems can handle it.
Absolutely.
Why is it that when our children, we put them in nursery and they suddenly fall ill with the runny nose, the fever, the unwell, it's their immune system being exposed to other little ones. Their immune system is learning about the world and all the things that can affect it, and it's learning so that later on, that's why there's certain conditions that affect children we don't see in adults. There's something called hand, foot, and mouth disease. We don't see that in adults, but it's very common in the under fives because their immune system is learning about it. By the time you're an adult, you've been exposed, and your immune system just exactly notices it and clears it before it becomes a problem and causes the infection. So there's many infections that we don't vaccinate against because they don't cause a problem, they don't cause complications, they don't cause issue. But the ones we do vaccinate against are because they can cause significant complications and problems. Hence why we offer a program, because we want children to grow, go to school, be healthy.
Be
And we see, why do we see neonatal and child under one mortality, the rates they are in other parts of the world a lot of us are from? Vaccination, or the lack of access to vaccination, is a part of this, as well as things like sanitation, access to healthcare in general.
yeah.
But and then when you're in the womb, the mother's antibodies crosses the placenta and protects that baby in the womb. Then baby's born and vulnerable because they're exposed to the environment and the world, which is why we sterilize bottles before we give them, feeds. We make sure we're washing their clothes properly. They're in environments that are clean, and we protect them in every way we can. So the next step of that is vaccinating them. So 2 months, 3 months, 4 months, 1 year, 30 months, 18 months, 3.5. Then we offer from 2 and 3, you can get the nasal flu at your GP or pharmacist now. And then when they start school, 4 years up to 16, they're offered the flu in school. Year 8, they're offered a booster for diphtheria, tetanus, polio. It's year 7, 8, or 9, one of those years. And the HPV vaccine that I've talked about, we're in Cervical Cancer Awareness Month. So I couldn't not stress that. And that's in year 8. Boys and girls are now offered that in year 8. And then as an adult, if you have a long-term condition like asthma, diabetes, heart disease, liver disease, you're offered the flu vaccine every autumn. That usually starts from October time. And then as you get older, we know older age, just because you've been around and you're more likely to have long term conditions. You've been around for 6, 7 decades. We know you're more at risk of respiratory illnesses or complications from some of these illnesses. So you're offered the flu, COVID, RSV vaccine, shingles vaccine, pneumococcal vaccine. So we vaccinate. I wouldn't say there's a top four. I'll say if you're eligible, get your flu vaccine every year. Definitely. I'm first in line. I had mine 1st of October was the first day I could get it. Had it straight because
Fair enough.
it doesn't stop your cold. I've got a bit of a runny nose. It doesn't
Yeah,
stop the little bits and pieces, but I don't want to have too much to do to be unwell, even though look after yourselves.
yeah,
But
yeah,
I'm doing it all. I'm taking my vitamin D. I'm trying to eat my rainbow of vegetables and fruits. As I
yeah,
talk to you, I'm talking to myself every time. I'm
yeah,
trying to get more steps in each day. Don't think about 10,000. If you do 2,000 now, like I do on my 12-hour days at work, aim for 3,000 the next day, aim for 5,000 the day after, you know? So move more, eat the rainbow of foods, stay hydrated with water, and get your vaccine. It's not one or the other, it's all of it.
yeah.
So
Absolutely, absolutely. You were talking
that's
about
top four. There's lots, there's more than four
yeah,
available for the kids in particular. But
yeah,
then when you're an adult, if you're eligible, get your flu. And also, people don't realize if they look after someone vulnerable, you're also eligible, even if it's as an unpaid carer, you're
yeah.
also eligible for flu vaccine. So you can self declare at your pharmacist or GP.
You mentioned other countries before, so there's a question here. Why do people from other countries have a lot of vaccines when migrating to the UK and end up having marks on their right arm?
Oh, so I think that's probably about the BCG, maybe, because that's the one that does, we all
Wow.
have, if we got it, we have, it causes a BCG scar.
Yeah, yeah,
So TB is more prevalent in other countries compared to the UK. So the UK, again, a public health measure is to protect. They don't want to see increased rates of TB because it can be infectious and spread by viral droplets if you're infected with it. I worked in South Africa for a year during my training, and there was something called multi-drug resistant TB, which was a terrible illness. And we want to prevent things before they become an issue.
yeah,
So that's why they'll screen people maybe coming in for immigration purposes, for work purposes. I know if you have to go to Australia or Canada, they'll ask for a chest x-ray. Even when I went to South Africa, they asked for a chest x-ray and they wanted to get occupational review to check you have had the BCG and then evidence of what vaccines you've had and what dates. So it is common for countries as public health. Is this public health? We're protecting our population of people to try to prevent and then if people haven't been vaccinated, recommend that they're vaccinated before they come. But the BCG is the one that will cause the scar on the upper
yeah, yeah, yeah.
arm usually.
But I want to buttress what Dr. Oge is saying because I think sometimes I don't know where the question is coming from, but there's a tone sometimes in people feeling like, oh, um, is it a bias thing? Or
Yeah.
so it's not about that. Just like
No.
Dr. Oge is saying. So one of the things that we can be grateful for is that because of the advances in public health and the understanding of the way that we do health here in the UK, our population has a higher expected life
Yeah.
expectancy and reduced levels of childhood and death. So we
Yeah.
shouldn't be oblivious or complacent about that. We should celebrate that. And as a consequence of that, if there are people coming from places where maybe the healthcare isn't necessarily as robust, then we have to be conscious that that can affect the population. In a similar way, the reverse is also true. For instance, um, in Nigeria, Nigeria has one of the best track records when it came to COVID and Ebola because they were very good at recognizing and closing the borders.
Yeah.
Like very, very, very harsh. And it might have seemed from their neighbors, oh, why are they doing that? But actually, they were very, very good at blocking even suspicion of illness. So therefore, the population wasn't affected in the same way that other populations were. So we
Yeah.
have to understand that the government has a responsibility to take care of the people that are within their cohort, and therefore, if there are people coming from places who have less good healthcare systems, it's not a accusation or a snobbery thing. No, we just
Yeah,
have to make sure that we're taking care of ourselves and actually taking care of them as well. Um,
absolutely.
so another question: what should we do if we had a bad reaction from a vaccine in the past? Can I answer this question?
Yeah, please.
So let me ask you the question. If you had a bad experience at McDonald's or a restaurant, does that mean you're never eating out again? Is that what
Mm,
we're saying? Because I think we have to put these things in context and
yeah,
understand that there's a difference between fear and risk. So nothing that we do in medicine is risk free. I tell my patients
exactly.
that all the time. So the fact that something bad happens, and if it's you, I'm really sorry, but we have to understand maybe statistically that's still a small percentage of all the people who are having that intervention. So yeah, you might have a vaccine and you feel rubbish after it for a couple of days, but compared to 99, 95% of the population who have the vaccine, they were just okay. Now, the,
Absolutely.
the thing you have to decide is what kind of person am I going to be? Am I going to be the person who fixates on the fact that I experienced a 1 in a million negative side effect and how that's going to affect the rest of my life? Or am I going to be the kind of person who recognizes, okay, I had a 1 in a million side effect, but that doesn't predict what is going to happen in the future? So, because to me, that's the answer to the question. The issue isn't the vaccine. The issue is what kind of person am I? Because
Yeah,
we come into contact and negative circumstances all the time. So if we
absolutely.
have a car accident, does that mean we're never going to drive again? If we go to a restaurant and the waiter's rude, are we never going to eat out again? For me, it's the same thing. I don't know whether you have anything to add about that, Doctor. Okay.
Yeah, no, I think discuss your concerns about if it was a real reaction because we can be allergic to aspects. So people just say, yes, I had a bad reaction, I was allergic. Even a lot of people say, I'm allergic to penicillin, but we always ask what happens, you
Yeah.
know? So do you know? Because, but to completely rule it out all vaccines in future because of I had a reaction. Was the reaction that you got a fever the next day and you felt a bit run down? That is a normal response. That tells us your immune system is kicking into action and doing
Yeah.
what we wanted to do. Did you have like lip swelling and facial swelling? That's a full anaphylaxis reaction, but that is incredibly rare.
Yeah.
So those of us that vaccinate will carry adrenaline out with us in the in case someone has an anaphylactic reaction to it. But it's like giving any medication. People can have anaphylaxis to even paracetamol or aspirin. That's very common. So it's always weighing up that risk and benefits and balancing things and knowing what is the reaction, drilling down what exactly happened, and then let's debunk. Is it actually down to the vaccine? Also, remember, you are exposed to people get the flu vaccine in the winter. There's the common cold, there's RSV, there's COVID, there's adenovirus, there's a whole bunch of other viruses circulating.
Yeah.
So you may have already been, even if you're not overtly unwell with it, your body may already be fighting an infection. Then you get a flu vaccine,
Yeah.
and then you come down and you think it was that vaccine. No, you already had something alongside. And we don't test in the same way we test. So you can't always pinpoint the cause. But physiologically and biologically, that vaccine cannot give you the actual infection it's trying to protect against. It's not biologically possible, but it's trying to do is stimulate your own immune system. So you need a working immune system. That's why we target people with depressed immune systems to be vaccinated in high, as much as possible. They're more eligible for more vaccines because we know it may not work as well because their immune systems are immunosuppressed either by an illness or by medication they're taking for their illness. So yeah, reaction. I would always say, what was the reaction? Let's break it down.
Yeah.
And again, remember, what are we trying to achieve with vaccination as well?
Yeah. Next question. Why does public health messaging often feel rushed or reactive rather than community led?
That's an interesting one. So I think they worked very hard for it not to feel rushed
Mm.
and reactive. It's supposed to be proactive and preventative and to promote health. That's the aim of it. That's the three core pillars of public health. But if people feel things are rushed, it can be, obviously there's national comms that comes through our radio, through the TV, that the government or the Department of Health kind of do. There's also more localized. I'm based in London region, so we have our own communication. We have, each council has public health within the local authorities now, so they all have a comms department that will be looking at the data for their area, what issues, what infections are causing a problem for our area, and then they'll be trying to communicate with their population accordingly. So it can sometimes feel knee jerk, and but there's a lot of planning, there's a lot of preparation that goes, and they're trying to do better with engaging with community groups like Khan, like, like charity sectors, people on the ground doing the work, raising up community ambassadors and peer advisors that can then speak to their population and also co-design some of the campaigns. So the system works very hard. And I'll say that's why Khan and you all are so important. They're looking for ideas. They're looking for what intervention will make sense and will work. So please feed in, whether to Khan, whether you have a local forum, they're looking for ideas of ways to engage better. So I'm sorry that it appears rushed at times. It's never
Yeah.
the intention, but we need to get involved with some of these campaigns and forums to co-design some of these strategies.
Yeah, I mean, I'd be interested to maybe break that question down a little bit more. 'Cause I heard that a lot during COVID. Oh, vaccines take this long and COVID's taking this long. And so I don't know whether that's just part of that, but I take your point in that obviously if something's happening in society, we have to be responding to it, and
Yeah,
it's not business as usual. But yeah, I think just like Dr. Oge said, there's a responsibility on all of us. If there's an opportunity to be involved, let's take
yeah,
it. You know,
yeah,
are we
absolutely.
are we speaking to our GPs and saying, oh, do you know what? I have a community or I have a sphere. Can I talk about vaccines in my, knitting group or in my women's group or my men's group or my church or whatever? There's lots of opportunities for us to engage, and I think
Yes.
that people who are involved in public health would welcome someone saying, "Look, how can I, further the conversation and further the debate like we're doing today?" Okay, next question.
Absolutely. Just to add as well, if we're not sitting around that table and contributing ideas, how will they know what we need?
Yeah,
We are going to effectively be ate for dinner, or we are done to instead of done alongside with.
yeah,
So
exactly,
it is
exactly.
about really getting involved.
Okay,
Absolutely.
100%. Next question. So, how should breastfeeding parents think about vaccines? Can they be passed on to the baby, or what about if they're pregnant? So,
Sure.
breastfeeding and
So
pregnant.
So a lot of vaccines we give in pregnant women are one of the eligible women for, or eligible groups, sorry, for vaccination. So flu vaccine, we recommend flu vaccination in pregnant women. We recommend pertussis, which is whooping cough in pregnant women, and RSV now. So COVID was recommended in pregnant women, but it's less of an issue. So they're no longer in the eligible population. So we know that the antibodies pass in the placenta. Breast milk, some elements of medication may pass in breast milk, but if you are eligible for flu as a breastfeeding mum because you have a long-term condition, breastfeeding in itself is not an eligible reason to get vaccinated with something like flu. But say you have asthma, then you would be eligible. It's absolutely safe to get the vaccine during breastfeeding. But if you have concerns, if say you're eligible for COVID because you have a condition that depresses your immune system, you're on high dose steroids, or some women have just gone through chemo or radiotherapy for previous cancer, then have a discussion with your healthcare professional. But it's safe. We vaccinate very small babies against some of these infections as well. So it usually is safe to have it when you're breastfeeding.
Okay, thank you. Next question. So, how can parents make informed choices without feeling judged or labeled as anti-vax? Now,
Yeah,
I'm sure you have something to say, but I'm gonna
yeah,
come in on this
please do.
afterwards as well. No, no, you go first. You go first.
So yeah, it's I always say for me, it's like as a GP, I look after families from cradle to grave. It's one of the joys of my profession. That one of the reasons I love it. So you get to trace and track families and systems over time. I really believe our practices needs to be safe, non-judgmental spaces for people to come to with their fears, their questions, their worries about it, but also be open to hearing why we think it's a two-way conversation. So it needs to be respectful. It does need to be non-judgmental. You need to be safe to bring your concerns and fears, but also be open to hear what the health professional is saying to you. So that mutual respect is crucial. So I hear about feeling judged. I think sometimes, yeah, there is a yes, why aren't you doing this? Feeling judged. But I think be constantly open because as healthcare professional, you're the expert in your life, your child's life. We are the medical experts. And that consultation is a meeting of two experts. So there should be mutual respect, there should be mutual trust, and there should be an open, safe space to discuss what's on your mind. So I think some people do feel judged, but I think people go with an arm and they're defensive already because they know they're doing something that's not recommended. And I
Yeah,
think just be open to hear and open to receive information so you can go away and continue doing your research, even
yeah,
if you're not going to change your mind right there and there. It's not the point. The point is to plant a seed so
yes.
that you can really go there and make an informed decision.
Absolutely. So for me, I'm big on. I think there's a number of ways of looking at it. I'm big
Mm,
on people taking personal responsibility for
yeah,
their lives. So
yeah,
that is in both situations. So one of the things that doctors have to adhere to is a code of medical ethics.
yeah,
One of those medical ethics is called autonomy. And it means that our job is to inform, but patients have a right to say, actually, I'm not going to do that. So it's
yeah,
not the doctor's job to dictate, you're going to do this, and you're
yeah,
and just like Dr. Oge is saying, we are doing our best internally to create welcoming, empathetic environments where people can say, but I've heard about this or I'm worried about that without feeling like we are being judgmental. So that's an internal thing from a health service. We
yeah,
have to do that, and we are doing that. But I think there's also the individual responsibility as a human who is in the driving seat of my life to be like, okay, I have to be the person to drive the information, to get the information. So, yes, I'll get all the information. I'll talk to my GP, I'll talk to my pharmacist, I'll talk to my nurse, I'll talk to my friends, but I still have to take responsibility for my decision. And I have to make sure that it's informed because unfortunately there's lots of misinformation out there.
yeah,
So I have to, not only do I have to get the information, I have to judge, well, where am I getting the information from? What's the qualification of this person to tell me that? Because unfortunately, online and YouTube, you don't have to have any qualifications or experience or knowledge to be able to post a website.
yeah,
And we all know that because of human nature, bad news is sells in a way that good news doesn't sell. So all
absolutely.
these, conspiracy theories and stuff, all of that is going to be more popular than just good, sound medicine. So you have to take responsibility. So the websites I'm going to, like who's writing this website?
Yeah,
What's this person's qualifications? And I have to sit with all the information and make a decision for myself. Now, once I've done that, I have to be ready for the conversation later. So let me give you another example. I am a Christian, and one of the things that I believe in Christianity is, let's say the Bible talks about things like um, certain standards of living. Now, because I'm a Christian, I defer to what the Christian says about the Bible says about that kind of standard of living. But in society, not everybody believes that.
mm,
And I might feel judged if I go and profess the thing that the Bible says. Um, but the issue is I have to make my informed decision. The Bible says this. I believe this. So even if I come into conversation with somebody else who doesn't believe what I believe, I'm not going to go in like Dr. Oge says, defensive or shrinking, because we live in a society where we all believe different things, and it's normal and natural for us to come into contact with people who are different. Debate is normal, disagreements are normal. The issue is how can we do that in a respectful way?
yeah,
So specifically when it comes to my health, get all the information. I charge you. Get all the information and make a decision, and then sit with it because you are the person who's going to deal with the consequence and the benefit of the decisions that you make. I hope that makes sense
Yeah.
to the question.
And kind of
Okay.
leading on for that, I think someone's put in the chat, what if parents are reluctant to give their child MMR? And MMR is the one that has, I think, alongside COVID-19, is the
Yeah.
most controversial ones, you
Yeah.
know? And I think we need to go back to why are they reluctant? They probably, whether there's an older child, I have families where an older child was diagnosed with autism, so they don't want to vaccinate their younger child, or they gave the child the 1 year, 13-month vaccine, but they haven't given them the 3.5 preschool booster vaccine because they're worried. Then they won't vaccinate a younger child. And I think it's having that conversation
Yeah.
again and reminding them we had a measles. We're still having a measles outbreak in parts of London. Measles has happened. We had a child die in Liverpool from measles. This should be a never event because it's completely preventable. And yes, it's rare, but it's also rare to have side effects. And autism is not linked. So let's have a conversation about what support you need. Ultimately, this mum with her daughter is just completely overwhelmed with the diagnosis and looking after her child. So that's what's the issue under the issue is what I
Yeah.
ask
Exactly.
about, try
Absolutely.
to and create spaces where you have the time. It can be so busy in a GP or nurse appointment. I know this, but I try to create a space where I'm thinking, what's this really about? And it's about this person struggling. So, what other support can we try to put in place? They may not get vaccinated, but at least they know
Yeah.
I'm there for them, and
Yeah,
that trust
exactly.
is built.
This is the
So,
thing, like, so
me,
I think it's a big issue in society. It's almost like we've equated disagreement
yeah,
to war. The fact that
exactly.
we disagree with you or I disagree with somebody else doesn't mean that I'm now an op. you
Yeah.
know, we can disagree, and that's what society and dare I say it, family is about. You
So yeah, I
obviously,
can disagree with her decision not to vaccinate her child, but I can still inform her this is what's happening. This is what's
exactly,
happening in the borough next to us.
yeah,
So
exactly,
if your child gets this, this, and this, I need to look up what that measles rash looks like because it's
yeah,
not something I see
absolutely,
that often. And
absolutely,
so this is what she's at risk of.
yeah,
So you have to be more aware. But
yeah,
let's have a conversation and let's have a conversation about what support you're getting. So
yeah,
you're
exactly.
building trust. Trust is a huge thing. And we know historically there are reasons why our community doesn't trust the system, as it were. But
100%.
I don't want to see a situation, like I said, where we're seeing increasing rates of problems, whether it's the cervical cancer, whether it's the admission to ITU with that respiratory illness, because we've not engaged in these evidence-based conversations and we've just blocked our minds to it. Because it's not just vaccine. Why aren't we going for our cancer screening?
Yeah,
You know,
yeah,
why
yeah,
aren't we engaging in our going for our long-term medication reviews and making sure our blood pressure and our sugar control is under
absolutely,
control?
absolutely,
Why aren't we really being intentional about eating well? Because you
yeah,
may not want to do that bit, but which bit are you doing then?
exactly,
Let's
exactly,
challenge each other to do
absolutely,
better because the end goal is what all of us want to achieve, better
yeah,
health. We want to
absolutely,
be healthy. So
100%.
what fruits are we producing by the conversation and the interaction is what
Absolutely.
I always say.
Absolutely. Absolutely. So I have another question here. So do people under 40 need to get the flu vaccine if they don't have any underlying health issues?
So if you're fit and well, you're not in the group that's recommended unless you're a carer. So you may be healthcare professional, so frontline healthcare. If you work in a hospital, work in a GP practice, even our receptionists are offered the flu vaccine every year because you're in contact with the public. If you are a paid carer, but importantly, if you're an unpaid carer, and if you're living in a house with someone undergoing things like chemotherapy, radiotherapy, or on medication to suppress their immune system, they're at risk. You're in a house with them. You're also eligible for the flu vaccine, even if you're fit and healthy.
Okay, thank you very much. So I think probably the last question. What advice would you give to people who are concerned about big pharma or
Yeah.
concerned about what took place years ago regarding vaccines and trials in Uganda?
Absolutely. Not just Uganda, northern Nigeria, the list goes on and on.
Yeah.
It is an issue and they need to be held to account. They have been to a certain extent. We are in the Western world in a capitalist society, so there's profits. But know that pharmaceutical companies also invest a lot. There's loads of trials and investment that it doesn't it doesn't lead to a profitable vaccine or medication at the end of it. But yes, profit is their intention, but there's also we need medicine. We need medicines as well. There's lots of research, lots of science. We work hand in hand. And I think, yes, there's historical unjust and things that have happened. There's no doubt about it. We need to rebuild trust, but don't let that stop you from looking at the evidence from today as about what we're trying to do. And again, look at the bigger, broader picture of what we're trying to achieve at the end. And pharmaceutical companies are a tool to help us achieve that bigger picture aim of better health for all.
Absolutely. I think there's a lot to say about this. I mean, so we could even talk about like um, our communities from an enterprise point of view, because
Yeah.
sometimes it can feel like these things are being done to because we're vulnerable, for financially whatever. So why don't we all become billionaires, and then, and then we can
Remember,
own
we need to
companies?
be the seat at the table. So we're
Absolutely,
not the
absolutely,
meal and we're not being done to. We are
absolutely,
co
100%,
designing as
100%.
well. And that's us getting engaged
Yeah, but
and
jokes
involved
aside,
in research as well, because that's something
absolutely,
else we don't do as
absolutely.
much.
But just jokes aside, just like Dr. Oge said earlier, so vaccine is one of the slice of the pizza of
Yeah.
the health of your life. What else are you doing?
What else
Are
are you
you
doing?
drinking water? Are you eating the rainbow like she mentioned? Are you going for walks? Are you exposing yourself to sunlight?
Yeah.
Are you taking your vitamin D? Are you having, conversations and, releasing your emotional angst?
Connecting with
Because
people.
all
Yes.
of those things help impact your physical health. Are you getting the information that you need? Are you what else can you do? There's lots of other things that you can do.
Yeah.
Or are you the kind of person who is just on the sofa, watching Netflix, adding weight, and eating lots of things that you shouldn't eat? These things have implications. I think I mentioned this last time. For me, the journey to becoming a fit granddad starts today.
Yes.
My children are, in teens and approaching teens. One day I want to be on the floor playing with my grandchildren. And it's not in 10 years' time when that journey starts. It starts today.
Now.
So,
Absolutely.
that's my lasting message. Anything that you want to say, Dr.
Yeah,
Oki,
just
before we close?
tomorrow belongs to those who prepare for it today. I think it's Nelson Mandela that said that or someone,
Okay,
but yes, the preparation and intention starts today. So
fantastic.
engage with your health with all the facets.
Absolutely. So again, Dr. Oge, thank you so much for
Thank
your time.
you. Thank you
It's
so
been
much.
informative, it's been engaging, it's been entertaining, and it's hopefully given us some nuggets that as we're listening now, we can say, I can change this.
Yeah.
Now, every one of us is connected to somebody. So I
Yeah.
would charge you, please find this video on YouTube and send it to your family WhatsApp. Put it on your WhatsApp status so that people can see. And again, Khan, thank you so much for providing a
Yes.
platform for us to have these conversations. I've been Dr. Aya. Thank you so much, Dr. Oge. I'm going to
Thank
pass
you.
on to Shola to close. I think you may be muted, Shola.
Can everybody hear me? Okay, perfect, perfect. Thank you very much, Dr. Oge, for delivering such a brilliant presentation. I think you're becoming a fixture on our Katip L Tower, and I'm just loving it. I'm loving it quite excellently. And I think I want to just say many thanks for talking to us about vaccination. But also, one of the things that I've taken away today is, you brought it to the foundations of public health. And I'm not going to forget this. I'm going to write it down actually. The three P's of public health: health promotion, disease prevention, and health protection. It's always a very, very insightful time, speaking with you. And I just want to say thank you to both Dr. Oge and Dr. Ayo as well. So I'm going to be sharing a few slides about some of the events that we've got coming up in the next few weeks. So hopefully you can see it. I believe you can. If you can see my screen, I don't know if somebody can just like,
Okay, yes, it's come now. Yeah.
okay, great, great, great. Great. So if you want to hear more about health promotion, disease prevention, and health protection within the context of the Caribbean and African sort of like community, just like Dr. Oge and Dr. Ayo has brilliantly enlightened us today, then Katip Health Hour is the place to be. And we have this every single Saturday, from 11 a.m. to 12 p.m. So we will be seeing you next week, same time, same place. Please email info@can.org.uk to stay involved. Rising Together. Join us for Rising Together, a nursing and midwifery leadership conference. This conference addresses one of the biggest challenges in the North, the low progression rates of global majority nurses and midwives into senior roles, an issue that impacts patient outcomes, organizational performance, and staff experience. We're bringing together national leaders, educators, practitioners, and students for a powerful CPD accredited event focused on fair progression, leadership development, workforce well-being, and inclusive culture change across health and care. I know it says the registration closed yesterday, which was the 23rd of January, but please, if you'd like to know more about this, it's happening in Manchester, do email info@can.org.uk to know more about this event. It's happening on Thursday, the 5th of February, 2026. Black Healthcare Awards. Nominations are now open. The Black Healthcare Award is one of our flagship events that we run every single year. Join us in celebrating excellence, innovation, and impact in healthcare. The Black Healthcare Awards 2026 will take place in London on the 4th of July, 2026, shining a spotlight on those breaking barriers and driving change within the healthcare sector. If you know of anybody that you'd like to nominate, please do visit the website blackhealthcareawards.can.org.uk, scan the QR code that you're seeing on the screen, or please email blackhealthcareawards@can.org.uk to learn more about the process. Our BEEP sessions, the Black Health Improvement Program, is open to all staff working in primary care across Enfield. It's a CPD accredited session that works with GP practices, pharmacies, dental surgeries, and all within healthcare to deliver fairer, more inclusive care and supporting the NHS Core 20+5 priorities. Please, if you'd like to know more about this, do email bhip-enfield@can.org.uk and the team would organize a session for your practice, or you can scan the QR code on your screen. Our Green and Arts Wellbeing Services is part of our Creative Health Initiative. Join us to connect, create, and celebrate wellness with Caribbean and African inspired events like painting, nature walks, and more. It happens in Bolton every Wednesday from 2 p.m. to 4 p.m. and at Stockport every Tuesday from 1 to 3 p.m. Please do email greenandartswellbeing@can.org.uk to know more about this. If you've missed any of the various emails or contacts that I've said previously about any of the various events, please do know that you can email info@can.org.uk and they'll be able to direct you for any of the initiatives that you've heard about today. Thank you for joining us today. Thank you again, Dr. Oge and Dr. Ayo. We hope to see you all next week. Bye.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.